How is it possible that musculoskeletal problems keep rising year after year, and yet we still approach most of our patients in the exact same way? We take their history, we ask questions, we listen to the symptoms, we examine movement, we do orthopedic testing, palpation, we look at active range of motion, passive range of motion, and when we still do not get enough answers, we often move on to imaging. And still, how often do we end up here? Imaging is clear, orthopedic tests are inconclusive, treatment helps, but the results do not last. We've all seen it, so maybe it's time to ask a harder question. Are we actually examining enough of the system to find the real cause? Because the truth is, most of the diagnostic tools focus mainly on hardware, the skeleton and joints. But MSK is not just skeletal, it is neuromusculoskeletal. And that means if we only examine structure, we may be ignoring the very part of the system that controls movement, stability, and adaptation and compensation. And if we keep examining only one part, how can we expect to change the outcome? See, this is where a neuromuscular approach changes everything. Because when you begin testing function, control, and compensation, you stop asking only where the pain is and start asking what is really driving it. And that is where the real clinical shift begins. So the question is not whether we need more treatment options. The question is, do we need a better way to understand the patient in front of us? Because if we want to change the curve in MSK, we might need to get back to basics and start looking at what we have been missing all along. My name is Morten Wolf, chiropractor.